Often when we talk about massage, we think about it being quite brutal and getting in there to take away a knot. But actually, when we talk about oncology massage, it's often about being gentle and being really kind to ourselves. Hi, I'm EJ. I am a personal stylist and a recent cancer survivor. And today we're going to be talking about the beauty of oncology massage and how you can learn the benefits of doing some of it yourself at home. So how can massage help healing after cancer treatment?
Massage is a wonderful, wonderful modality throughout the entire cancer experience, not just in recovery. It reduces pain, it reduces nausea, it reduces anxiety, improves sleep quality. There's quite a lot to it if you want it to be, but it can also be incredibly simple and quite straightforward.
What types of massage are good for post-cancer patients?
Yeah, so look, I absolutely love oncology massage. Oncology massage is probably the most relaxing form of massage that you'll come across. Now, when we get people coming to us and saying, hey, I've got cancer and I want a massage and this bit hurts, poke it out for me, it's up to us to say, you know what, I think I can do more for you by doing less. It's about making the person as comfortable as possible and as relaxed as possible. And it's absolutely mind-blowing to give and to receive. It's really easy for the family members and the loved ones and whānau to feel a little bit powerless, like they can't really contribute because here's this person who's going through this awful journey and they're sort of just on the outside, just waiting to be told what to do. So I love teaching the family members. It's a brilliant way to connect. It's a brilliant way to bond. It's really, really powerful. Another really neat technique for some people is scar massage. Now there's some rules and limitations around that. So we sort of say at least 6 to 8 weeks post-healing. What we know about scar massage is it can soften up the scar tissue, including surgical and radio burns. It improves the comfort of the scar. It improves the appearance of the scar. It also helps people to improve their movement. It's really common post-breast cancer surgery, for instance, for people to get frozen shoulders. Just improving that scar mobility is really quite helpful for that. Let's say, for instance, I've got a scar down my hand there. It would be simply very much a stretching of the tissue. You don't have to get in there and be really brutal. You can be really, really gentle and have a really amazing response. And the idea is you go in all directions. So you go against all its planes, diagonal, no fingertips, and just stretch. Also, it's a really nice way. A lot of people are quite traumatized by their scar. And it can be a really nice way to reconnect with your own body, to get back in there and just say hi and say, look, you're not that bad after all, and we can be okay. The other one I want to talk about is lymphedema management. So lymphedema is a recognised side effect of surgery, radiation and chemotherapy. It's coming about through damage to the lymphatic system. The specific massage technique for it is called MLD, or manual lymphatic drainage. And ideally it should be performed by a therapist who is trained in combined decongestive therapy, not just manual lymphatic drainage. Having said that, you can't always get to one. So there are lots of really lovely sequences that you can look up on Google, on YouTube. If you're massaging yourself, you just want to move away from the area that's affected to the other side of the body or down the body.
Can you tell us about some self-massage tools?
Your cheapest and your easiest is your tennis ball. I like to just put it on the floor and roll my foot over it when I want to give myself a foot massage. If I've got a particularly sore spot, I will often lie on the tennis ball into that tight muscle. I'm saying using caution with people who are still in the middle of treatment, in case they have low platelet counts. So for instance, a lot of people talk about the new fashion at the moment is these gua sha tools. They are very different to massage, and I would be very concerned about someone who had a low platelet count using them. I'll often use in my clinic, and I use on myself quite often, as a massage gun. So this is my big beastie. They don't have to come this big, they don't have to be this intense, and they're quite nice for getting into tight muscles.
Can you share a few things with us that people can do right now to get things started?
There's classes that you can do with Look Good Feel Better on self-massage. Just moisturising your skin is massaging. thumb circles on the palm, and you're getting in between all those pads. You can sort of feel the bones underneath, and you can just massage in between those and stroking the fingers. Yeah, get in contact with everything. Don't sort of just go, oh, well, that's a massage. Get into all the nooks and crannies. It's delicious, absolutely delicious.
We hope you enjoyed that episode. One of the standout pieces for me was learning about the deep connection you can have when a whānau member and a cancer patient can learn about massage together. I think it's one of those really important things that I would have loved to have learnt when I was going through cancer, and it's something that I know I will take with me to help family and friends in future. For more information on this episode, go to www.lgfb.co.nz.